During the 1930s, an era marked by bold exploration in medical science, a small cadre of pioneering physicians embarked on what was, until then, deemed a biologically insurmountable endeavor: the transplantation of human organs. Among these efforts, particular emphasis was placed on the kidney, as surgeons attempted to extract this vital organ from living or recently deceased donors and implant it into patients grappling with the terminal stages of renal failure. Yet, despite the ingenuity and determination of these early attempts, they were invariably thwarted by the formidable adversary of the human immune system, which, upon recognizing the transplanted organ as a foreign invader, launched a relentless and devastating assault to obliterate it, leaving few recipients capable of surviving beyond mere days. This seemingly insurmountable challenge persisted until 1954, when Dr. Joseph Murray achieved a revolutionary breakthrough that defied prevailing limitations. His unprecedented approach involved the transplantation of a kidney between identical twins, a procedure that not only succeeded, but also allowed the recipient to live an additional 8 years. The key to this remarkable outcome lay in the genetic congruence of the twins, which effectively circumvented the immune rejection that had historically doomed earlier transplants to failure. Fast forward more than 7 decades, and the field of kidney transplantation has undergone a transformative evolution, with over 100,000 such procedures now performed annually in the United States alone. The kidney, a pair of diminutive yet indispensable organs approximately the size of a clenched fist, functions as an extraordinary biological filter, processing a daily volume of blood equivalent to the capacity of a bathtub. Beyond its role in waste removal and the regulation of fluid balance through urine production, the kidney plays a central role in the production of red blood cells, the metabolism of vitamin D, and the synthesis of critical hormones. However, the functionality of this vital organ is often imperiled by chronic conditions such as diabetes and hypertension. In the case of diabetes, elevated blood sugar levels induce an overfiltration response that inflames and damages kidney tissues, while hypertension compromises the organ's intricate vasculature through chronic constriction and structural degradation, both of which may ultimately culminate in irreversible renal failure. When complete kidney function is lost, patients are typically reliant on dialysis, an arduous and time-intensive process fraught with significant medical complications. For such individuals, kidney transplantation emerges as a vastly superior alternative, offering not only the prospect of prolonged survival, but also a substantial improvement in quality of life. However, the pathway to transplantation is far from straightforward. Historically, the greatest obstacle lay in identifying a donor whose immunological profile closely mirrored that of the recipient, a challenge that frequently necessitated an identical twin or an exceptionally close genetic relative to minimize the likelihood of immune-mediated rejection. Advances in medical science, however, have radically altered this paradigm. Modern immunosuppressive therapies now enable physicians to subdue a recipient's immune response both before and after transplantation, thereby broadening the pool of viable donors to include not only family members and friends, but also altruistic strangers. Nevertheless, closer immunological matches still correlate with improved outcomes, prompting the development of innovative solutions such as paired kidney exchanges. These programs facilitate the matching of incompatible donor-recipient pairs with other pairs facing similar challenges, enabling each recipient to receive a more compatible organ from an alternative donor. Once a compatible kidney is located, the surgical procedures for both the donor and the recipient, though intricate, have become standardized. The donor's kidney is typically removed through minimally invasive methods, often employing robotic assistance to minimize trauma and expedite recovery. For the recipient, the process involves making an incision in the lower abdomen, where the donor kidney is implanted. The surgeon meticulously connects the kidney's artery and vein to the recipient's circulatory system to establish blood flow and attaches the ureter to the bladder to facilitate urine drainage. Interestingly, the recipient's failed kidneys are rarely removed, as they may retain residual filtration capabilities that contribute to overall renal function. Post-surgery, the recipient undergoes intensive monitoring to ensure that the transplanted kidney begins functioning autonomously, filtering blood and producing urine as expected. On average, transplanted kidneys remain functional for 12 to 20 years, necessitating that some recipients undergo multiple transplants throughout their lifetime. In extraordinary cases, individuals may possess 4 or even 5 kidneys within their bodies due to successive procedures. Living donors, on the other hand, typically experience a rapid recovery, often leaving the hospital the day after surgery and resuming normal activities within a matter of weeks. While no surgical intervention is without risk, the majority of donors experience minimal long-term complications and continue to lead healthy lives with a single kidney. However, the scarcity of willing, suitable living donors remains a significant bottleneck in the transplantation process. In the United States alone, the national waiting list comprises approximately 90,000 patients seeking a kidney from a deceased donor. Yet, despite widespread registration for organ donation, only a mere 0.3% of individuals perish under circumstances conducive to organ procurement, creating a severe disparity between supply and demand. Tragically, this shortage results in the deaths of approximately 17 patients each day as they await a compatible kidney. Nevertheless, the relentless ingenuity of medical science continues to push the boundaries of possibility, with researchers actively exploring groundbreaking advancements such as lab-grown organs, 3D printed tissues, and artificial kidneys, heralding a future in which the limitations of transplantation may one day be eradicated entirely.